from Faith Forward Media, this is Healthcare Musings. I'm Dr. Hesham Hasabala. Welcome to Healthcare Musings, everybody. Happy to have you with me. I am so happy. I've been excited for this episode for quite a long time. This is is October being Breast Cancer Awareness Month, and there was a tweet that I read that I just thought I had to have these two guests on. I'm so honored and delighted to have Dr. Simran Matta on the show and April Burke on the show. Dr. Matta is an intensivist like me. She is the medical director of critical care at the Bay Health Hospital Sussex campus in Delaware, where I'm also a teleintensivist there, and I go and I visit the hospital. It's a great hospital, and then I go to the beach and have dinner where we don't have beaches here in Chicago. So super cool to have her on the show. I also have April Burke. She is the Chief Advanced Practice Officer for Sound Physicians. Great person, great clinician, and I wanted to talk about women in medicine. And I'm going to first welcome you both to the show. I'm so happy to have you on Healthcare Musings.
Thanks.
Thank
Excited
you.
to be here.
Oh, my excitement is much, much more. So thanks for your time. I'm going to start right off. So I read this tweet where it said that 50% of male physicians, when they introduce a female physician colleague, they don't say, "Hi, this is Dr. Matta, my partner." They say, "Hi, this is Simran." So I was floored by that. I was like, that can't be true. So I asked a physician, one of my partners, and I asked her, and I said, "Is that true? And she's like, yes. She confirmed that many times they will say her name is Dr. Richa Sharma. So, and she couldn't make it on the show today, unfortunately. She said, I asked her, and she said, yeah, that's true. They say, "Hi, this is Richa, not this is Dr. Sharma." And I just was, as opposed to if I have a male colleague like my regional medical director, Dr. Cruz, I'll say, "Hey, this is Dr. Cruz, my boss," right? I was floored by that. In fact, I saw a button that says, "It's doctor," actually. And, and I'm like, oh my God. And so start off and talk to me about that. Talk to me about that phenomenon. Have you experienced that? Talk to me about that. I want to start off the conversation with that. Dr. Matta.
Say that I'm lucky that I personally have not experienced that particular bias, but do biases against women in medicine float around? And yes, they absolutely do. And I want to start off by addressing the bias in the first place, right? So bias it's a prejudice. It's a prejudice that we hold against a particular thing, person, or a group of people. And a bias is a universal phenomenon. All of us here on the show, we are biased. No matter how strongly we are committed to egalitarian values, we are still biased. And the root cause of all the bias that including we women in medicine face is implicit bias or unconscious bias, which by definition is unconscious, which means we're not aware that we hold this bias and the effects that it is having on us and the way we treat other people. And bias is a heuristic trait that we inherited from our ancestors. Because when we encounter something that is fundamentally different from what we expect, it triggers a flight, fright, fight mechanism in our amygdala. And this bias is what kept our species alive for millions of years, right? So if you encountered a member of a foreign tribe or an animal, you did whatever you had to keep yourself alive. And while in the modern society these days, we don't encounter a lot of physical threats, but there are psychological threats. And the reptilian amygdala is unable to distinguish between a physical threat versus a psychological threat. So when you encounter something that you did not expect, like you encounter a woman as a CEO or a black man as a pilot, it triggers that, the flight, fright, fight mechanism, and it causes a surge of stress hormones in our body. And so bias by itself is not harmful. It just exists. We're all biased. But it is when we allow that bias to change the way we treat people, to change the way we speak to people, that's when the implicit bias becomes explicit and discriminatory in nature. So the first
So,
step is
oh,
for us to recognize our bias, right? Own your bias, embrace the bias. How are we ever going to overcome something that we're not even aware that we hold in the first place? And the reason I bring this at the very beginning is because a lot of times when we think of bias, we think of it from a good person, bad person paradigm, right? That, oh, this person must be bad because they are biased. But we're all biased here.
okay. That's a very good point. April, have you faced bias as a woman in medicine?
I would say that I don't think I really have. Maybe because I'm, like as an APP, I introduce myself to patients as April. Like I don't, so when somebody introduces me as April, that's what I would expect. And I don't think that I've been fortunate to work with teams that, really respect my clinical judgment, my medical opinions. And so I haven't really, I mean, I will say that, and it's not necessarily women in medicine, but more that, like as the APP role was new, right? Some patients would just not be familiar with it and would request to see a physician, which obviously that's something that we would say, absolutely, well, I'll have my physician colleague come by. So I haven't really noticed much of the women bias in the APP world that I've worked in, but more so just, the role and as it is, if is evolving, so our patients are becoming used to that. So.
Yeah, no, that's actually great to hear. And speaking of, because there's so many times where in the ICU, the nurse will tell the patient something, and then the patient says, I want to see the doctor. And then I come after the nurse and I say the exact same thing. And they're like, oh, okay. Right. From the
Right.
doctor. And I didn't say anything differently. I supported exactly what the nurse told me. But there's something about my white coat or my MD or physician on my badge that confers authority. Is that authority undermined? Have you found, Dr. Matta, that authority is undermined because you're a woman?
Yes.
Have you ever like where they? Well, who are you? Oh, it's doctor actually. You know what I'm saying?
I personally have not encountered it, but recently I will tell you this example. A resident came to me and she was a PGY3 and she was outright fired by a patient because the patient, quote unquote, told her that I do not think that women should be doctors. So when she came to this patient's room to examine him with her PGY1 male intern, he told her to leave the room because he did not think that women should be doctors, and he allowed the intern to come and examine him and treat him. So, and this typical stereotype of, and she's not just a female, but she was an Asian female. She's petite, just like me, and height makes a difference. There's this privilege around how we look.
Interesting. So, do you? I know a lot of hospitals have badges that say physician versus nurse versus. I don't know. I don't know if your hospital, Dr. Matta, you have that. And at my hospital, we do. Like I have a physician, and then the APPs have advanced practice and respiratory therapy has, so that because all of us wear scrubs, so you can't tell like who's who. I don't think I've ever been. Well, let me take that back. One time I was like, oh, I thought he was the respiratory therapist. And I'm like, no, I'm the doctor, bro. When I walked into the room. And so I've started wearing my white coat, right? Because because that then knows, oh, this is the clinician, right? Even though just especially when I go and talk to the patients, there was a study I had talked about it on my podcast earlier about our attire, and that patients immediately form their first impression based on our attire. And with women, it was not, it was complicated, right? That with whether they wore a white coat, whether they wore scrubs, or whether they were, a casual, it's different. Have you had that kind of experience?
So we don't have the badges, but but here's the thing. When I introduce myself to patients and families, there's two different ways you can do it, right? And I've seen this, in residents that have faced a lot of biases. It's like I could just go be there. Hey, I'm Dr. So and so, and you have acute COPD exacerbation. We're gonna do blah blah blah, and you're just like this timid, soft, quiet person. You're not commanding authority. Versus if I walk in the room and I'm like, hey, this is Dr. Matta. So I reviewed your chest x-ray, blah, 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 and this is what we're going to do. You see, the tone of your voice, the way you stand, the way you command the authority, that sets the tone for, okay, this is the doctor. And that's what sometimes I kind of guide the women physicians to do is, for a male, you may not have to do so and so things to command the authority. It automatically comes sometimes with the gender. But for females, it might be a little bit different, and you have to adopt to that way of speaking, the way you stand, so you are able to command that respect and the authority that you are the physician here in this room.
Wow, April, have you had that? Like, have people walked in? You walked in and say, "Oh, who are you? The nurse, or are you the tech, or something?" Or has that ever happened? Has that ever happened to
I've
you?
had it often happens, not so much they'll say like, who are you? Are you the nurse? But if they're on the phone with somebody and I walk in the room, they'll say, oh, I gotta go, the nurse is here. Often that will happen. And then I introduce myself as the PA. But I do know, like, I think there is kind of truth to the white coat piece of it, so that, like, during COVID, I feel like I stopped wearing my white coat because, it was just germs everywhere, it felt like. And so,
Totally.
and so I think we noticed it a little bit more there. And so some of our teams have started making sure that everybody is wearing their white coat when they go into the room, so that patients, it's more clear to them who they are. But because in the setting of, they'll say, I haven't seen a provider today, right? And so, like, they're trying to really reinforce, like, I'm your provider for today, whether in seeing the patients. But that does happen for sure.
And please, Dr.
Sorry,
Monaco.
I want to piggyback on what April said. So and I agree, when you walk in the room and before you've opened your mouth to say anything, and if they are on the phone, if the patient's family or patient is on the phone with someone, as soon as they see you, automatically they'll be like telling them, oh, I've got to go, the nurse is in the room. That has happened plenty of times. When they see a female, even if it's in a white coat, there is an automatic assumption that she must be a nurse.
Really? See, that's never happened to me. Like, that's never, whether I'm with but I always wear my coat because I want people to know I'm the doctor, right? But whatever time they walk in, oh wait, hold on, exactly, I have to go. The doctor walked into the room. That's so interesting. That's wow. Like, and going back on what you said, Dr. Mata, about the way you speak. Because I don't think about, now, of course, I'm very passionate and outgoing and everything like that. So I don't have to work on my tone. If anything, I have to calm my tone down in some certain aspects or some certain situations. But it's interesting. Have you both noticed that you have to work on your tone for people to take you seriously?
For me, it's kind of a part of me. So
Knowing you, I don't think you, like, as soon as I met you, I'm like, oh, okay, I know who's in charge here. Like, I didn't have to think about it, or you didn't have to. I mean, I knew right away. I'm like, okay, this person is of authority, and this person I have to, do what she says, right? Because
But you see,
the
if
way
I
you
did not,
the way you command yourself.
yes, but if I did not talk that way, right? If I didn't speak that way, then there is going to be a question, right? And this part that you mentioned, like, for example, even when you talk to people outside of work, like if someone that you met at the grocery store or just outside in and they're like, oh, what do you do? Like, oh, I work at Bay Health. Oh, okay. Are you a nurse? Automatically, right away, which nursing school did you go to? So, and I'm like, no, I'm not a nurse, I'm a critical care doctor. So even people outside of the hospital, there's an automatic assumption that if you're a female that works in a hospital, you've got to be a nurse.
That's interesting. April, how about you? Have you had to work on your tone for people to take you seriously?
I don't know if I've ever really thought about that, like the tone that I use. I think I just use the tone I use, if that makes sense. But I've never really, I mean, other than again, I think people just not being familiar with the APP role, right? And then having to in saying, hey, can I? And when I go into the room, I explain the role. Like I say, I'm a PA. I'm working with, Dr. So and so today. We work together as a team to provide care for you. And so I think I sort of kind of just upfront explain my role and who I am and why I'm seeing them. Um and back to the nurse comment, I don't know. And once I introduce myself and things like that, then they understand my role. And I don't know if it's that so much that the nurse is the person who's in the room the most, right? So when somebody comes in, they might just assume it's the nurse. I don't know if that plays a role, how much that plays a role in it as well. But I've never really like thought about the tone. I think I just use the tone I use and it seems to go well. So if that makes
Oh
sense.
wow, no, that's great. So, Dr. Mata, you're later on next month. You're going to have a whole event about women in medicine. Talk to
Mhm.
me about that and
Yeah.
what kind of spurred that initiative.
Yeah, it kind of came from, really just a lot of residents, coming towards me with the experiences and the biases they were facing. A lot, of course, a lot of it from the male patients, but a considerable amount of that was from other male colleagues and male attendings. And women sometimes also face biases from other women, even women that are subordinate, because, I think for women to just do the job that they are supposed to do, um, the help that's available to you, sometimes you have to demand that help, right? But if but for males, you just have the help available to you. You don't have to really demand it. So even there's biases coming from the subordinates as well. So we wanted to kind of take it at an institutional level, because what can happen is if someone is facing a bias and you may just keep it to yourself thinking that you are the only one, but similarly there could be another woman facing the same biases. And so we thought if we just talked about it, so we're creating a safe and open space for people to have these discussions, it's going to be so much better. Because as challenging as it is to be a woman in medicine, the good part of it is also having other women in medicine. So we wanted to foster a sisterhood within the program. We wanted to foster more mentor-mentee relationships and give people that safe space to discuss their problems. Because when you have a problem and if you think of hiding, try connecting. It's going to change your entire perspective and change the way you deal with problems. So we wanted people to just get together and kind of sort of find their tribe.
Interesting. But April, have you found that you've been undermined by other women, or have had challenging dealing with other women, like for example, female nurses, for example, or even male nurses? Do male nurses treat you, April, differently because you're an APP?
I haven't really experienced it myself. But again, I think it's to whenever I work with our nurses, I always try to approach it from a standpoint of like, providing education, answering questions, things like that. So I've always kind of done a lot of effort to build a rapport with my nursing staff so that when they do call me with questions or if they have questions, I do feel like they feel open to come to me and say, hey, why are we doing this or whatever. And it's always an open discussion. And so I haven't really, I feel like they find me pretty approachable. So sometimes I actually feel like they're probably more willing to call me sometimes, because it's, I'm open to those discussions and those questions about the patients. Not to say that my colleagues aren't, but I think just kind of, like I would go to the floor, like they call me with a question, I'll go to the floor, kind of talk through it with them and spend the time sort of building that rapport with them so that they, feel comfortable coming to me with questions.
So, no, I mean, that's great. I mean, we don't want this to be a cry fest about how bad it is for women in medicine. And at the same time, you, Dr. Mata, did this whole thing because clearly there is an issue right there, and that's what I'm trying to bring awareness to, that there really is an issue. I mean, they wouldn't make the button. It's doctor, actually. right? If the if there wasn't something like that, and I've never had to do that, like say it's Dr. Hasabala. You know what I'm saying?
Here.
Because I don't like to do that, although I've wanted to 100 million times. I've wanted to. So some people just it's actually Dr. Hasabala, bro. And but there's something there, right? So you had hinted about it, Dr. Matta, about the challenges. What are the challenges of being a woman in medicine? And then April, I have the same question for you after.
The challenges can be talked in two different domains. One is just challenges of being being a woman in medicine on a day-to-day basis, which is kind of putting your authority there that I am the doctor here, commanding respect from your peers and the male patients, and also from male nurses. I'm glad you brought that point up because I have seen most male nurses. They're very nice, they're very respectful, and they will treat you, like you're the physician here, you're the leader here. But have I come across some male nurses that are absolutely not comfortable taking orders from female physicians? 100%. Although they are a minority, but there is absolutely those male nurses out there that are just not comfortable taking orders from female physicians. And you can tell, not everybody is comfortable in the presence of a competent, self-assured woman. And that's the fact. So yes, there are male nurses that I have encountered that are not comfortable with female physicians. And the other domain that you want to talk about is, or I want to talk about is women in medicine in leadership roles, right? If we just look around ourselves now, at least half the physician workforce is comprised of women. But when you look at key executive leadership roles, women are systematically underrepresented when it comes to these so-called upper echelons of leadership. So if hard work and accomplishments is what takes you there, then we'd already be there. You see, a person does not just start as a subordinate and then becomes a leader. There is a process, oftentimes a grooming process and a network of support that enables that person to become a leader. But if I don't fit that mold of what a leader should look like, right? If women are being viewed as quiet and obedient, and I don't fit that mold, then that's a pretty hard mold to overcome.
Wow. Well, I mean, we have two leaders here, right? And so, April, I have the same question for you. What are the challenges that you feel for women in medicine in general? And then you are an executive here, right? Like, is it? In fact, our practice, I think we pride ourselves with having a lot of female executives in our practice, and I think with you, Dr. Matta, as well. You're the director of critical care at the hospital, right? So, what challenges do you have, or have you seen, or what do you think are challenging facing women in our field, April?
Yeah, I feel like I'm not helping your cause here right now because I actually feel like in the APP space, I feel like it's a little bit. I mean, most of the APP leaders that I have worked with have been female, so I'll say that. So I think in my journey, it hasn't been so much about being a female versus more the evolution of my role and getting, adding leaders to the APP space, if that makes sense. Just because as we started using PAs and NPs more, when I first came to Sound 10 years ago, we didn't have APP leadership, right? Like we worked with our physician leaders, but over time, we really recognized the need for dedicated APP leadership to help our colleagues with there's a subset of challenges that are unique to an APP, right, in the clinical setting. And so for me, my journey was more about showing the need for an APP leader versus it being a female, if that makes sense.
Yeah. So it's well. We are very honored to be joined by Dr. Chia-Shing Yang. She is vice president of she's a hospitalist by trade, and she's one of our executive vice presidents for Sound Physicians, and she's able to join us. I'm so happy to have you, Dr. Yang. Hopefully your audio will cooperate. Welcome to Healthcare Musing. So happy to have you.
Thank you. Honored to be here.
So we had begun the conversation about, and I wanted to get your take. I'm so happy you're here, about the challenges of being a woman in medicine. Now, April, thank God, April's had a really good experience. Hasn't had a lot of people saying, "Who are you? Get out of here! I don't want to be taken care of by a woman." Dr. Matta has seen that with residents who, like, they'll kick out a third-year female resident and let the male intern, take care of them, right? Because then this person said out loud, "I don't think women should be doctors." But have you felt that way? And I had begun the conversation by saying half of male docs, when they introduce their female partners who are docs, they say, "This is, you know, this is uh, Jennifer. This is not Dr. Smith, right? Or this is not Dr. Yang." Have you? What's your take on that? What have you seen in your career? And again, we have 3 physicians, and we have talked about how there's been there's a relative dearth of females in positions of leadership, and I have 3 females who are in positions of leadership, right? So I've picked the cream of the crop. But what has been your experience, Dr. Yang?
Couple of really good questions you got there. So to start, again, first things first, I've certainly experienced what Dr. Matta has referred to. I've been mistaken not just by patients, but by other healthcare professionals as well, as specifically not a physician. And that's despite all the paraphernalia. So it really says to me that socialization and culturation, that's all very real. And it sometimes is very hard to break, even in a time and place where we are today, where over half of national medical students enrolling and matriculating are female now. And that's just in medical schools. That's not even including all the other health professions by and large. So I do wonder how long that will stay the norm. I think the other question that you'd asked in terms of how being introduced. So I have the blessing of being in medicine with a difficult first name and an easy last name. And so it really makes it much, much easier for people to simply call me Dr. Yang. Back when Grey's Anatomy first came out, there was a little bit more chitter chatter about my last name. And that certainly didn't hurt per se in terms of folks remembering, oh, she's the doc. But by and large, I've not had the issue. However, I have observed what you reference in terms of how other physicians, especially women physicians, get introduced. I've observed it. I've also, again, noticed that it's very much habit and cultural. And I would say these days that the observation actually floats both genders. I've seen both men and women introduced in that manner as well, other colleagues. And so I do think it's a little deeper than pointing a finger at our male colleagues. They're also functioning within a larger cultural element as well. And the last topic that you've talked about, which is being in leadership versus being in the profession, really love hearing that question. I think, April, you and I may have chatted a few years back. There's a sound blog post that I put out there along that topic. And it is, I think, a twofold issue. We talk about sort of the pipeline, right? Who's coming into medicine. I think that is getting better. Like I mentioned before, a lot more women matriculating, but then it's the pathway. How are they really thinking through leadership, being able to step into the leadership roles, and are they getting the sponsors? And I don't think sponsors are necessarily that one-to-one, I pull you up. That's also very, very important. But it's also, hey, I'm going to pave a space and a way and for some of these things to become possible, and to really think through, hey, what is doable, what's feasible. In that regard, I think that I have been fairly lucky, perhaps a little luckier than most, in having the right kind of mentors, the right kind of sponsors to, it's as much show the way as pave the way, I would say.
That's awesome. Do you feel that it's been harder for, do you have to work harder to be in the position? Did you have to work harder to be in the position where you're at?
That is a tough question. Um,
I have it for
I
all of you. This is not, this is not going to be an easy walk in the park here.
yeah.
Because I think in some contexts, it's you, depending on if you're minority or if you're a minority, and I've seen it in my career. If you're a minority, I think you have to work hard. I think you may have to work harder. Like it's you can't make a mistake, whereas others can. Right? Have all of you? And that this question is for all of you. You can, Dr. Yang, start with you. Have you feel that you had to work harder to get where you're at?
I don't know. And I say this like I don't know because I don't know individuals' silent struggles. And I think that's a really big part of it. Other than I think the obvious pieces, I'll say like, gender, background. I've been lucky to probably, I would guess, on the totality of have um, less personal demons to struggle with and less other things to handle. And that's by pure gift of family and friends who have supported along the way. So I say that as like a yes and because I don't know where other people are necessarily coming from. Now, are there opportunities where I have been told, your gender, your age, all the demographic things that we're not supposed to be discriminating on, right? Has it ever been heavily hinted that this is not an opportunity for you because of that? Yes. In retrospect, would I have gone back and traded out those opportunities? Would I have like gone after them? Did I say like, oh no, I would actually say that because of that, it's forced me to take the pathways possible. So I find that a hard question because I feel very privileged to be where I am today. And I think that part of the struggles um, are what create it. And I think there's some literature out there around having to overcome adversity as being part of that pathway to leadership and to doing what you want to do with a lot of passion. And so I think I don't know. I don't see it. Maybe it's the optimist in me. I don't see it quite that hard.
No, that's great. April, have you seen that? Have you had to work harder, you think, than your male colleagues or others that you've led or on your teams or everything? Or do you think in our practice, because you're the chief APP, right? So do they have to work harder?
I'm kind of with just saying in the fact that like I mean, I've had a great journey, right? Especially at Sound as I've grown as a leader. Like I came in as a bedside clinician and then it started with a few committees that to be honest with you, like my leadership journey sort of started with being approached to join committees. And I sort of was of the mindset of, I have super little kids. I'm super busy. I don't know if I have time for this. Right. And so in my medical director at the time, who was a great mentor to me, was like, just try it, see how it goes. And so that, that went from committees to director roles to now my current role. And so it was a gradual journey for me. And I think it was just one of those that sort of just naturally progressed for me. I don't think that I think I'm fortunate, as just things said, I feel privileged to be where I am. But I think it was just a natural course of progression for me in this journey. As I continued to make an impact and show, what I could do to help support our APPs, that it just kind of seemed like a natural progression, I guess, for me. So I haven't really, I would say that my male colleagues, like, we have APP leads that are both male and female. And I would say that I feel respected by both of them the same, right? Like, I don't feel like it's different the way that either of them interact with me based on being male or female.
That's wonderful. Dr. Matta, have you the same question to you?
Um, I, it's hard to say. It's hard for me to say that I am, um, if I've had to work extra hard to get to where I am, because I think I've always worked hard. Now, so I don't know if I can definitively say that I've had to, because see, I think as not only do we need to recognize our bias, we also need to recognize the privileges that we have, right? So even though I am an Asian female of color and I'm an immigrant Asian female, but I have certain privileges. I tell you what, pretty women get away with a lot of things. That is a privilege. I never had an ethnic accent.
I'll never say that. So you can say that all day. I'll never say something like that.
But you see, I never had an ethnic accent, and I have recognized that these are privileges, because when you don't have certain privileges, like I've seen with some people, they don't have certain, privileges. I have seen people being biased because of the way they look, because of the way they speak, the accent that they have. So I have seen that biases happen because, external factors are absolutely crucial here. Sometimes we look at certain people and we sum up their value or their worth based on the biases or assumptions that we have. So my worth may not meet your criteria that I should receive the best advice possible, that I should have access to all the mentors and sponsors that are going to take me to where I need to be. Right. So like Dr. Yang said, she did recognize that she has had the privilege of having access to the right mentors and sponsors. Not everybody's going to have that. If you talk to a Black woman from rural Mississippi, she may not have had these privileges of having the access to the right mentors and sponsors who are going to take her to where she needs to be. So yes, would she need to work extra hard? Maybe.
Yeah, those are very good points. We're almost out of time. I do want to touch upon Breast Cancer Awareness Month. This is October, and it's almost exclusively a female phenomenon. There are men with breast cancer, and they're very, very rare. But before I do that, there was a very funny story that I have with Dr. Yang. So I knew about Dr. Yang. She was big shot in the practice, right? And I knew that kind of our kids went to the same school. So this one time, this lady comes up to me and she's talking to me. Hey, did you go to Becker's? And our CEO at the time is telling you all these things, and I'm like, oh yeah, no, I didn't make it. And I'm like, man, how does this person know a lot about me? Like, he knows that who my boss is, and she knows like they're going to Becker's and all these things. And then I just was trying to, and I was like, did she see my profile on LinkedIn or that? I tell my wife, and I'm like, yeah, this lady came up to me. She knew all about my job, and she's like, you idiot, that's Dr. Yang. I'm like, that Dr. Yang? What? So I ran after her, and I'm like, oh my God, it's so good to see you. Good to meet you. I had never met her before. It's just so funny how, again, it's just like, I knew all about her, but I had never met her before because our kids were at the time at the same school. That was a funny story when I first met Dr. Yang, and now she's even in a bigger role. Wanted to end upon Breast Cancer Awareness Month. Thank God I have not faced it in my family. And it's still, I've seen a lot of colleagues be afflicted with this disease. And I just wanted to kind of hear each of you comment about it and kind of get your insight and wisdom. And we can begin with Dr. Yang.
Well, first of all, to be fair, Dr. Hospital, that was right after the pandemic, and I just moved into town. So, we had not gotten a lot of face-to-face time at that point. So breast cancer, I've got a couple of incidents of that in my family, so I'm at elevated risk personally myself. And I think of it as everybody please get screened. It certainly does work. Early treatment modalities are significantly better than late treatment modalities by and large. I will say that it is one of a list of, and this goes both, all directions, gender specific disease processes. It's just one that is a bit more better. It's better studied. Therefore it's got better treatment. It's got better screening. And I'd really love to see more of that across the gender spectrum, along with, today, this is Breast Awareness Month. It's not necessarily heart, but that's the other one that comes to mind, right? Same disease. It should no longer be an atypical presentation, but sometimes we still kind of teach it as such in different genders. And so and it's even not gender, it's ethnicity specific, different skin tones, different presentations of different types of other diseases. So all which is to say, I encourage everyone to get screened, get checked out. It's part of, I think we're seeing this increasing incidence of cancer in younger and younger ages. This falls into that category as well, of those that are seeing a lot more incidences at younger ages. So never too young. If you're concerned, ask your doctor. Please don't leave it up to just GPT or Gemini or whichever your AI doctor is of choice. Please do get it checked out by your primary.
April.
Yeah, I'll second all of that. And we've had some cases in my family, but also many friends of mine have been diagnosed at young ages, to your point. And the one thing that I will harp on here is that many people that I know that have been diagnosed have done so in a self-exam and have had a normal mammogram 6 months earlier, right? So like they had a normal mammogram, they were doing a self-exam 6 months later and found something, and that's how they were diagnosed. So in addition to doing all of your, yearly mammograms and things like that with your physicians, please, please, please do the self-exam as well. I can't stress that enough. I've seen it happen to several people. And so, very important. So.
Wonderful. Dr. Matta.
I second everything that Dr. Yang and April have said. I think you both have mentioned all the excellent points, but I would want to emphasize that the demographics have shifted. And, even if you're a young woman in 30s or, early 40s, I would still encourage everyone to, get screened. You may not have had a family history, but truly the demographics of breast cancer have shifted. And so it's great that we have this awareness month, but, there's all the resources that are out there and available, but they are no use if you don't access to them. So please access the resources that are available to you. I agree with April on self exams and, consult a real doctor, right? Consult your primary care doctor and take advantage of the resources that are available to us in the society that we live in today.
Wonderful. That's a great way to end. I think I want to stop. I don't want to end before plugging. April, you have a podcast as well, right?
I do. I have a podcast with my colleague, Alicia Sheffer. So we have our podcast. It's called On Call with April and Alicia. And we designed it so that it's kind of exciting for everybody to listen to. We do a little bit of little banter and then a little catching up with each other. And then we always try to pick a healthcare related topic and talk about it. A lot of sort of like fact or fiction type episodes. So if you haven't checked it out, tune in there as well.
Wonderful. I have listened to it. It's just pretty awesome, and I hope to get on the show one day. Hint, hint. It's not so subtle hint. All three of you are extraordinary women in medicine, leaders, thought leaders, thinkers, innovators. This is why I wanted to have you on the show, and your insights have been completely, totally invaluable. And this will be an episode for the ages. So I like to thank each and every one of you for your time and you for honoring the show, Dr. Chia-Shing Yang, April Burke, Dr. Simran Matta. Thank you so much for being on Healthcare Musings. It was awesome to have you all.
Thank you.
Thank you.
Thank you.
Thank you for listening. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.